Welcome back to the final episode of this series, Your Sexual Health, Your Power. As always, I am your host and companion on this journey, Uchenna Amadi, and I'm still here with the wonderful duo, Dr. Igbodike and Mrs. Unyime Etura. It has been an exciting learning experience for me, and I'm sure our listeners feel the same way. We've covered why your sexual health is your power. We've also talked about understanding risks and early testing. And then we just finished testing with confidence. And wow, it was really a confidential episode, if I must say, but it was enlightening. Now we switch gears to building a culture of prevention. And I want to start with Dr. Igbodike. What role does preventive testing play in building healthier relationships and communities? This your smile. I feel like you're about to lecture me because I'm ready to jot things down.
That's encompassing because I heard you mention community. All right, so it's good. Now, usually when we talk about prevention, usually in medicine, it goes through the primary, the secondary, and the tertiary prevention. Okay, so let's look at primary. Primary prevention is what we've been talking about all this while, the issue of education, the issue of awareness. As simple as it sounds, that might be the gospel somebody's waiting for to have a change of heart. All right. We talk about the issue of knowing your status, knowing a lot about your sexual health. And we said that sexual health, we mentioned that it's quite very, it's a whole component, So that knowledge, that's knowing that this disease exists is not just a myth, is very, very important, So once the individual has that knowledge that there is something called syphilis, something called gonorrhea, infection, trichomoniasis, and all sorts, HIV, hepatitis B, the individual will be equipped to now say, okay, how do I know? Then we talk about the issue of the screening, all right? It's when you know that you go to be screened. Then during the screening, it's dichotomous. It's either of two things. It's either that the person is infected or the person is not infected. So the non-infected individuals or cohorts, we now guard against being infected. Those ones that are infected, we move to the second stage, which is the secondary prevention. Now, I've got the disease. What do I do? Very important. The issue of course, the hospital. You have to get to the hospital. You have to see your doctor who's going to take a history. He's going to examine you. He's going to do some testing again, all right? And, of course, the treatment. Okay, so these individuals have to be treated. Then treatment has its own package, treating right. We talk about the issue of when you see your doctor. He has a particular... So every disease entity worldwide has its own management protocol. So the person is treated right and the person gets well and the person is counseled not to go back, to that same, habit. And of course, the partner is also treated. So extension of the treatment to the partner so that you can save a community. When you treat the individual alone and you don't treat the partner, you have not saved the community because the person can also infect another person infect another person like that.
Sorry. Right. Multiple partners, Uncle.
How
do you want to navigate that one?
So, well, unfortunately, if the individual is able to remember all the partners,
all those people, these are the problems.
Exactly. So the individual have to keep on. They are what we call snowballing like in research. Yeah. So you tell this person tells the person, this person tells the person. So if the individual cannot, tell, okay, Nkechi, please come on, we need to, Aisha, and what have you. And also in the issue of polygamous setting too.
Wow.
That has to also be discussed. If the man has it, then the other wives also have to get tested. All right. Then the tertiary is now we're talking about rehabilitation. Already an individual has tuber blockage, bilateral tuber blockage from maybe sometime SCI that she has some time ago, gonorrhea when she was 16 or 18. Is coming to haunt her when she's 32. And in fact, the truth of the matter is that most of the time in gynecology, we don't really necessarily go back to start looking for what caused the tubal blockage. At that point, we're talking about rehabilitation. This individual wants to get, wants to conceive. How do we help?
Yeah.
Unfortunately, as of today, the only treatment or management for individuals with bilateral tubal blockade is either you do what we call hysterolaparoscopic tubal cannulation
in
to
English,
see.
sir.
Okay, so we can use some little surgery to see if we can open the tubes.
Okay.
Yes, you can open the tubes. Sometimes you may succeed, sometimes you may not.
Wow.
When you don't succeed, then the patient will be cancelled for IVF or adoption or surrogacy, as the case may be. So you can see what an infection that occurred at age 23 is now leading to rehabilitation at age 31.
Wow.
All right. So that is how it goes. And again, when you look at all this, so the prevention, like we said in summary, we are looking at the primary one, the secondary when the person already had the infection, the tertiary when there's an effect of that particular infection and we need to get the person out of it and, of course, reintegrate the individual into the society.
Thank you very much for taking time to explain it the way you did. So let me come to Mrs. Unyime. So I want to talk about partners. When partners are involved, how can partners encourage each other to get tested without creating mistrust? If I want to digress a bit, this, if I start it, we will not leave here. When a man wakes up and says he's going for DNA test, the woman is already, as in the trust there is already. So again, when it comes to STIs too, that trust thing is hanging by a thread. Because if peradventure, let me not, please just, let's talk about this one.
Okay, I think that should be a little bit easy. Coming from what Dr. Igbodike said, it's, that's why we're having this podcast, to educate the public on STIs as a sexual health. It actually starts with open communication. Because a lot of marriages or partnership, that's, intimacy, they might not have known themselves when they were 15 years, 16, 18. So you shouldn't judge each other based on their past. If you've decided you want to stay together, I like this person, I love this person, first of all, there should be that open communication. Communicate about your wellness, your health. And sexual health is part of the wellness. It's not just about, how are my organs doing, my liver, kidney. Sexual health should also be part of that discussion. Then secondly, after discussing, fix a day, go for the testing together. Because I think that's where the mistrust actually comes from. You have a husband coming to do his test. After doing the test, maybe he's found out he's okay, or maybe there's an issue. He'll now go back home and tell the wife, go and do the test. Or it may even be, we've seen a lot of boyfriend and girlfriend. The guy comes first or the lady comes first. Then later on, the guy is coming. That's where I think issue comes up.
Yes.
Go for the testing together. Seek counseling together, both pre and post.
That's wow. Dr. Igbodike.
Yeah. You see, a relationship is something that can be easy, can also be difficult. It is what is individuals play on the table with is understanding. And when there is understanding, it becomes quite easy, like she mentioned, my partner, So, but one thing is clear. When people are coming together for something that is long-lasting, and there is no trust, it might be difficult.
Yeah.
In fact, that's already, you have not already started, you're already failing. So that openness, like she mentioned, is very, very important. And again, because people are afraid, and when you don't have a lot of skeleton in your cupboard, it even becomes easier. So it might become more difficult when there are a lot of skeletons because We don't know the fear of unknown. Absolutely.
And it's coming in front to bite you.
Exactly. So that's why we're talking about the issue of taking our sexual health very, seriously. Because if you are serious about it, then you don't have anything to fear. In fact, you even know the outcome of the result before you started. But we even encourage you when the person is prodigal, no problem, come. The word that can happen is that it can be positive, all right?
Yeah.
Yes, but of course, remember the secondary prevention. If it's positive, something can be done. You don't want to die so early and you'll die for nothing. If you must die, you die honorably. And part of the way to die honorably is only knowing what has actually killed you. So you don't want to be dead.
I'm sorry. This aspire to perspire. Wow.
Exactly. So have a knowledge, have a at least. That is bravery, So the power to know is very important. And of course, we encourage I know at this point, because Nigeria is a very religious country, whereby individuals do this package testing before they become married. We encourage that they should also add PC to it.
Exactly. Because all what we have there is your genotype, blood group, pregnancy test.
No. You should talk about this because we should become quite intentional about what we do. And when we do that, believe you me, remember that we are going to protect the individual, protect the spouse, and protect the children, and of course the community.
Yeah. Let me even speak to the religious society, because yes, blood group and genotype, they are important. You see, this pitchy is more important. Let me put it that way, because they will still come back to your church and tell you somebody is not able to born and you will now start praying prayer that you should have advised them since to see their doctor with all those. So it doesn't stop at blood group and genotype. Let's start thinking STIs. So I'm coming to a more sensitive part.
Okay.
So the role of education in changing how Nigerians approach sexual health. And this is very important to me because I know that sex education is being taught in some schools and some parents are against it because of the culture and the mindset of our country where we find ourselves in. So it's a bit tricky because, again, we have the Gen Zs and the Alphas. Gen Alphas that want to ask you anything. You tell my son, do this, he'll ask you, why, mommy?
Yeah.
And I'm wondering how. You cannot even ask my mother why. When she tells you to do so, the backup slap is waiting. But these ones, they want to know why. And I'm worried because, I don't know. So, Doc, you will help us to break this down because we know it is important. We also don't want to what's the curriculum? Who is judging this curriculum? Because these children seem like they know more than we knew at their time.
Yeah.
So there are two things we are dealing with. The role education will play in this sexual health information for the kids. And then how do we manage it so that the children are not too exposed to what they are not supposed to know?
Yes, this is quite amazing. In fact, this session wouldn't have been complete if we did not talk about this sexual education. You see, yes, like you said, it's tricky, but it's very, very important. It's important because, again, knowledge. Now, exposition to knowledge and the level of knowledge will vary with age as the individual matures. All right, a 3-year-old, a 2-year-old, because we have seen people, rape occurring in young girls of 5 and 6.
Wow.
So, and at that age, that means the girl might not understand what's happening. If the parents, the mother, the father, took out time to explain to the girl child that an uncle shouldn't say, come and sit on my lap. An uncle should not touch touch your this, touch that, depending on the names you are using, your PP or this.
Yeah.
You have already started sexual education. Because the awareness to the girl child is that nobody should touch me in my breast or call me my wife. All those things. Yeah. Please. That is how it starts. All right. So the girl child is now having a knowledge. Then as they keep moving, before they get to teenage age, there are things you'll be exposing them to and the name that you use. And it becomes imperative by the time they are teenagers, you have to make it full blown. All right, because if you don't teach them, they will teach her for you outside. Wow. And whatever they are going to, the knowledge she gathers might not be the right one. And that time, the brain is actually picking up very fast. She picks those ones and she feels that she's validated because they are telling her you're a fine girl, and she will fall into those problems. So it's important as a mother, as a father, to keep telling the young girls about the importance of their sexual health. You know, the importance of abstinence. All right. Yes. Okay.
Cannot be overemphasized.
Yes, cannot be overemphasized.
I like how you mentioned it 3 times.
Yeah, because abstinence, the A, actually saves you from all these issues. If you don't start, where will you come from? I remember a lady that I've not known anymore was asking me, Doc, I want to do a pap smear. I said, why do you want to do pap smear? He said, because they've been telling. I say, my dear, you don't need any pap smear at all. Where will the HP going to come from? You know, so that knowledge is very important. So the more we tell the individual, we tell the, then when it gets to teenage age, like you said, a lot is happening, and and this issue of raping a girl child is also, and even a boy these days.
Yeah, exactly.
Yeah, even a boy. Yes, because they don't know. It starts with small luring things that does not necessarily, but individual that when you have sex, if you have to define what sex is, because she's seen her menses already. She can get pregnant. She must know what is sex. You are not telling her to go and have sex, but telling her what is sex is. That if you have this, that you can actually get pregnant and get diseases. Mention all the diseases. Yeah. Tell her all of them. In fact, get pictures. You can download them from the internet so that you see how it looks. You say, wow, you say that, but that's the truth. So we shouldn't be afraid to educate our kids about this, all right? And also the entire population and community. When they know there is awareness and it's easier not to till them into the secondary care, they will remain at just primary. Which is just counseling, all right? So I feel that our society, like we started in the first episode, nobody is even having sex at all until there is pregnancy. Then you know that this person must have had sex for the person to become pregnant. So it is a notion that should be changed. Yeah. We should talk about these things with liberty and, of course, knowing how we build it up from different age groups till whenever the individual is ready to have sex.
Quite elaborate. So, Unyime, I'm going to talk about you've talked about SYNLAB the peachy, yes. Yeah, the packages. So through those peachy packages, how can SYNLAB contribute to this preventive culture?
Okay, thank you very much. Like mentioned earlier on, we have the different peachy packages, the peachy series, and in each package there are different tests in it. SYNLAB has curated that, made it available at affordable prices for people, because there are someone that could come in and the person is able to afford the peachy premium, which is the molecular-based testing. The person would do it. But there might be someone that comes in and the person just wants to do a peachy plum, depending on their pocket. But when they go into our facility, they sit down, they are shown the bouquet of tests. They go through each package, see what it contains, and they pay and get the test done. So in doing that, they get to know their status. And remember, they shouldn't do it alone. They should come with their partners. Because I believe anybody coming to do an STI test and a peachy test, you definitely have a partner. You're not a 14-year-old that is just, I want to do peachy. No, you have a partner. So please don't do the test alone.
Or partners for the
partners, yeah. Come with your partner or your partners
or your village people
to do the test.
Okay, so what is your one key message to Nigerians about their sexual health and power?
Okay, I would say know your status. Practice safer sex. Don't go on rampage. Clock in your peachy series and be peachy certified.
Punchline drops like, wow. Doc, take it up a notch. Yeah. What's your one key message?
So we should know that world over, that every day we have more than 1 million people that have new infections.
When you come with this
STI.
prevalence, like my heart will just fly. What's going on?
He mentions this.
I'm telling
like
you.
1 million.
So, yes, per day. That's a lot. But that
Daily?
tells, yes, WHO as of 2022. So when we look at those facts series, it tells us that something is happening. And for goodness sake, please, we mention abstinence, okay? If you're not yet married. If you're married, please be faithful. And when you are faithful, if you must go out of faithfulness or try to, why should I even talk about this? Well, we have to say, because in health, it is possible that one decide not to be faithful. Please remember to protect yourself, because when you are protected, you protect your partner, and the community is also protected at large.
Yeah.
Wow. This has been powerful. That's all I can say. With all these things we've heard, I am sure that we've been able to internalize a whole lot of them, because today we have traveled the full journey from understanding your sexual health to early testing, to confidence, and finally to prevention. It has been rich, insightful, and truly empowering. I've enjoyed every moment of this discussion, and I'm sure you have too. Sadly, we have come to the end of this enlightening journey. A huge thank you to our amazing guests, Dr. Emeka Igbodike and Mrs. Unyime Etura. They have shared their knowledge and they have given their time. As our tradition demands, I'll invite you both to sign the legacy board. This is our tradition, so you help us sign to mark your presence, to let us know that you were here.
Wow.
Yes.
Okay.
Yes. Because we're really happy to have you here. But to our listeners, my one key message to you would be to stay healthy, stay empowered, and remember, your sexual health is your power. Do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. You can also follow SYNLAB Nigeria across all social media platforms. Thank you once again for joining us in this Valentine season. Be Peachy certified. My name is Uchenna Amadi, and this is me signing off.